had just the last month had chest pain. Not every day, not crazy severe.
He thought it was indigestion.
I was hoping it was something else that was an attempt to deny the real event, I think.
Well, first of all, our primary care physician is here, and so we came to see him initially, and then Dr. David Goff, who is the cardiologist, is also here, and he performed a stress test.
He and I very much hoped that he had a lesion that could be fixed with angioplasty. In talking to him, he had been having chest discomfort on and off for several months, but in a fashion that suggested it was his old hiatal hernia or reflux symptoms. It wasn't related to exertion. Actually, the pain that led to the stress test awakened him from sleep. It turns out that the lesion he had is one of those that's outcomes are still rated better by surgery.
Stents were not a possibility, so we had to go to open heart surgery, and that was the only option. So, I mean, at that point, it was clear that we had to do that.
I was shocked. I really thought when we first came a week ago that he was going to get us an EKG and they were going to give us medicine and we were going home. And then the next day when they came out from the cardiac cath lab and said, it's not good, you know, we can't fix this with a stent, I was really caught off my game on that one. I was shocked. And, you know, the idea that someone, you know, is going to have open heart surgery is pretty scary.
We started doing open heart surgery in 2007. Small numbers at first, 45 the first year, 70 the second year. The last couple of years it's been between 60 and 70. But for the 2 years, 2012, 2013, we did well over 100 open heart procedures with no deaths. We were able to do the coronary artery interventions where we open obstructed coronary arteries in the prescribed time of 90 minutes or less in virtually all the patients that present here. We just have an excellent team here with the residency program. We have a seasoned physician in our ICU at all times through the night. With the new training program in cardiology, we just have some well-trained, alert, up-to-date physicians taking care of you.
The physicians here are incredible. I mean, that goes without saying. But the staff, the nursing staff, even to the custodial people, just everybody, you know, so kind and so thoughtful. Do you need this? Can we help you? When visitors came, they said, everyone that came to see us said, you know, it's kind of hard to find this unit. And even though they give you directions at the desk, and someone always stopped and said, you look like you don't know where you're going. Can we help you? And sometimes they even brought them here. And I think that's above and beyond, and it's been like that the whole time we've been here.
We had several nurses that really did a good job with us that we had for several days running, the same nurses, and that was very nice.
I will have to say, I will be back. I mean, if we have to come back, I should qualify that. Hopefully we won't be back, but if we have to come back somewhere, we would gladly come here. It is spotless clean. I mean, the decor is wonderful. The facility is great. And I mean, it's just, you know, it's been a good experience for us, really good.
The funding issues are always a problem. For instance, we built 2 cath labs here thinking that would be sufficient. We need another one. And there are some issues of a combined surgery cath lab to allow for more complicated procedures that are now being done. There are a lot of opportunities for facility improvements.
For certain services such as this, which I think is maybe the best in town now, for cardiac care or open heart surgery and follow-up, and certainly, as I said before, it's a life-saving experience for me.